Are you tired of battling migraines without finding relief? If so, you're not alone. Migraine sufferers know all too well the debilitating pain and disruption these headaches can cause. That's where Imitrex and Inderal come in, two popular medications with the potential to provide much-needed relief. But which one is the true champion in the battle against migraines? In this video, we'll dive into the Great Migraine Showdown. Imitrex versus Inderal. Which one wins the battle? We'll examine the similarities and differences between these two medications and explore their effectiveness in alleviating migraine symptoms. Whether you're already taking one of these drugs or considering them as a treatment option, this video will provide you with valuable insights to make an informed decision. Join us as we compare Imitrex and Inderal, weighing their advantages, potential side effects, and overall impact on migraine management. By the end, you'll have a clearer understanding of which medication may be the better choice for you. Don't let migraines dictate your life. It's time to find the winning solution in the migraine showdown. Understanding Imitrex and its mechanism of action. Imitrex, also known as sumatriptan, is a medication specifically designed to relieve migraine symptoms. It belongs to a class of drugs called triptans, which work by narrowing blood vessels in the brain and reducing inflammation. This narrowing of blood vessels helps to alleviate the throbbing pain, sensitivity to light and sound, and other symptoms associated with migraines. Imitrex is available in various forms, such as oral tablets, nasal spray, and injections. The choice of administration depends on the severity of the migraine and personal preference. The oral tablets are convenient for those who prefer oral medication, while the nasal spray and injections offer faster relief for more severe migraines. Clinical studies have shown that Imitrex is highly effective in treating migraines, with many patients experiencing significant relief within 2 hours of taking the medication. However, it's important to note that Imitrex is not a preventive medication and should be taken at the onset of a migraine for optimal results. Let's now explore the benefits and effectiveness of Imitrex in more detail. Exploring the benefits and effectiveness of Imitrex in treating migraines. Imitrex has proven to be a powerful tool in the management of migraines for many individuals. Its ability to target the underlying mechanisms of migraines, such as blood vessel constriction and inflammation, has made it a popular choice among patients and healthcare professionals alike. One of the significant benefits of Imitrex is its fast-acting nature. Many individuals report feeling relief from their migraine symptoms within a short time after taking the medication. This quick onset of action can be particularly advantageous for those who experience severe migraines and need immediate relief. Additionally, Imitrex is known to effectively alleviate not only the pain associated with migraines but also other common symptoms such as nausea, vomiting, and sensitivity to light and sound. This comprehensive approach to symptom relief allows individuals to regain control over their daily lives and resume their regular activities. As with any medication, Imitrex does come with potential side effects. The most commonly reported side effects include dizziness, drowsiness, and injection site reactions for those using the nasal spray or injections. However, it's important to note that these side effects are typically mild and transient, and the benefits of Imitrex often outweigh the risks for many individuals. Understanding Inderal and its mechanism of action. Now, let's shift our focus to Inderal, also known as propranolol. Unlike Imitrex, which is specifically designed for acute migraine relief, Inderal belongs to a class of drugs called beta blockers and is primarily used as a preventive medication for migraines. Beta blockers work by blocking the effects of adrenaline on the body's beta receptors, which helps to reduce the frequency and severity of migraines. By regulating the heart rate and blood pressure, Inderal can help prevent migraines from occurring in the first place. Inderal is available in oral tablet form and is usually taken on a daily basis as a long-term preventive treatment for migraines. It's important to note that Inderal may not provide immediate relief from an ongoing migraine attack, but rather aims to reduce the frequency and intensity of future episodes. Exploring the benefits and effectiveness of Inderal in treating migraines. Inderal has shown significant success in reducing the occurrence of migraines in many individuals. By targeting the underlying causes of migraines, such as increased heart rate and blood pressure, Inderal can effectively prevent the onset of migraines and provide long-term relief. One of the notable benefits of Inderal is its ability to not only prevent migraines but also manage other conditions commonly associated with migraines, such as anxiety and hypertension. This dual benefit makes Inderal an attractive option for individuals who experience migraines alongside these comorbidities. Another advantage of Inderal is its relatively low risk of side effects compared to other preventive medications. Common side effects include fatigue, dizziness, and cold hands or feet. However, it's important to note that these side effects are generally well tolerated and often diminish over time as the body adjusts to the medication. It's worth mentioning that Inderal may not be suitable for everyone, particularly individuals with certain medical conditions or those taking specific medications. It's essential to consult with a healthcare professional to determine if Inderal is the right choice for you. Comparing the effectiveness and side effects of Imitrex and Inderal. When it comes to comparing the effectiveness of Imitrex and Inderal, it's important to consider individual needs and preferences. Both medications have demonstrated efficacy in managing migraines, but their mechanisms of action and administration methods differ. Imitrex provides fast-acting relief from acute migraines and effectively targets the symptoms associated with ongoing attacks. Its ability to restore normalcy quickly makes it an appealing option for individuals who seek immediate relief. On the other hand, Inderal focuses on preventing migraines by regulating heart rate and blood pressure. This long-term approach may be more suitable for individuals who experience frequent migraines and wish to reduce their overall frequency and intensity. In terms of side effects, both medications have their own associated risks. Imitrex may cause dizziness, drowsiness, and injection site reactions, while Inderal may lead to fatigue, dizziness, and cold hands or feet. It's important to discuss potential side effects with a healthcare professional and weigh them against the potential benefits. Factors to consider when choosing between Imitrex and Inderal. When deciding between Imitrex and Inderal, several factors should be taken into consideration. These factors include the frequency and severity of migraines, personal preferences regarding administration methods, comorbidities, and individual response to previous treatments. Individuals who experience infrequent and severe migraines may find Imitrex more suitable, as it provides fast relief when needed. On the other hand, individuals with more frequent migraines and a desire for long-term preventive treatment may benefit from Inderal's ability to reduce the overall occurrence of migraines. It's also vital to consider personal preferences regarding medication administration methods. Some individuals may prefer oral tablets, while others may find nasal sprays or injections more convenient or effective. Discussing these preferences with a healthcare professional can help determine the most suitable option. Real-life experiences and testimonials from individuals who have used Imitrex or Inderal. To gain further insight into the effectiveness of Imitrex and Inderal, let's explore real-life experiences and testimonials from individuals who have used these medications to manage their migraines. Samantha, a longtime sufferer of migraines, found Imitrex to be a game-changer in her life. She often experienced severe migraines that caused her to miss work and social activities. After starting Imitrex, Samantha noticed significant relief within an hour of taking the medication. She now keeps Imitrex on hand for whenever a migraine strikes, allowing her to quickly regain control and resume her daily activities. On the other hand, Mark's migraines were frequent and debilitating, often lasting for days. He decided to try Inderal after discussing his condition with his healthcare provider. Over time, Mark noticed a significant reduction in the frequency of his migraines. While he occasionally still experiences migraines, they are much less severe and easier to manage. These real-life experiences highlight the potential benefits of both Imitrex and Inderal in managing migraines. However, it's important to remember that individual responses to medications can vary, and what works for one person may not work for another. Consulting with a healthcare professional is crucial in determining the most suitable treatment option. Alternative treatment options for migraines. While Imitrex and Inderal are commonly prescribed medications for migraines, it's worth noting that alternative treatment options are available for those seeking non-pharmaceutical approaches or additional relief. Lifestyle modifications, such as maintaining a consistent sleep schedule, managing stress levels, and avoiding triggers like certain foods or environmental factors, can significantly reduce the frequency and severity of migraines. Additionally, relaxation techniques, such as deep breathing exercises, meditation, and yoga, may help manage migraine symptoms. For individuals who prefer non-medication approaches, alternative therapies like acupuncture, chiropractic adjustments, and biofeedback have shown promising results in reducing the frequency and intensity of migraines. These therapies focus on addressing the underlying imbalances in the body and promoting overall well-being. It's important to note that while alternative treatments can be effective for some individuals, they may not work for everyone. It's always recommended to consult with a healthcare professional before starting any new treatment approach to ensure its safety and efficacy. Conclusion: choosing the right migraine treatment for you. In the great migraine showdown between Imitrex and Inderal, there is no definitive winner. Both medications have their own unique benefits and mechanisms of action, making them suitable for different individuals and migraine management strategies. Imitrex offers fast-acting relief from acute migraines and effectively targets the symptoms associated with ongoing attacks. On the other hand, Inderal focuses on preventing migraines by regulating heart rate and blood pressure, reducing the overall occurrence of migraines. When choosing between Imitrex and Inderal, it's important to consider individual needs, preferences, and medical history. Factors such as the frequency and severity of migraines, personal preferences regarding administration methods, and comorbidities should all be taken into account. Additionally, exploring alternative treatment options and discussing them with a healthcare professional can provide a well-rounded approach to migraine management. Remember, migraines should not dictate your life. With the right treatment approach, you can regain control and enjoy a life free from the burden of migraines.